Hey everybody, this month we're going to be talking about different conditions that we treat in our office, and I want to start at the top, and we're going to be talking about cervicogenic headaches. So headaches are something that a lot of our patients come in dealing with. It's a very common condition that we see in people, and the main reason is because so many people now are spending a lot of time sitting at a desk, on cell phones, on tablets, on computers. This is how we live our lives now, and so a lot of times the positions that we put ourselves in order to do that work or in order to use those technologies puts a lot of strain on our neck and our upper back, which can lead to a lot of neck pain and headaches. So the common kind that we see in our office is called a cervicogenic headache. So cervical spine is the neck, it's the upper 7 bones of the spine. And so cervicogenic means that the headache is actually coming from the neck. It's one of the more common kinds of headaches that we see. The best part about it is that a cervicogenic headache is also one of the most treatable forms of headaches. So when we're talking about cervicogenic headaches, we're talking about the upper few bones of the spine. So we're dealing with the occiput, we're dealing with C1, and we're dealing with C2. If we have any kind of restricted mobility in those joints, that's when we start to see the environment set up for people to start struggling with headaches. Those joints in particular are surrounded by all the nerves that wrap around the back of the head and come up over the head. So those headaches that feel like they're kind of a headband formation often come from an issue in the upper cervical spine. Now the good news is that if the issue is because these joints aren't moving well, then the solution is to get those joints moving well. And that's what we need to do from a chiropractic standpoint. So when people come into us with cervicogenic headaches, we're going to focus first and foremost on getting those joints moving the way that they should. If we can restore fundamental mobility of the upper joints of the neck, we can see a lot of those headaches start to go away pretty quickly and on their own without any kind of pharmaceutical intervention. Now that being said, as we talked about, a lot of times what causes these issues is because people spend a lot of time on technology. They're spending a lot of time at work, on computers, at their desk. And so the postures that they put themselves in every day are often what are leading to these conditions that we see. So what we do every day, we have a tendency to get better at that, for better or for worse. So we start to develop some muscle imbalances. We get tight, we're kind of slouched forward a little bit, we get real tense in the chest, we get weak in the back. So when we have someone with headaches, we often have to give them some rehab to do at home to make sure that we address some of these postural imbalances that come from long periods of sitting at a desk, being on a phone or a tablet or something like that. So first we got to get the joints moving better. Second, we've got to address some of these postural muscle imbalances. And third, we often need to give our patients some sort of ergonomic advice. Now, ergonomics is how your workstation is set up. And if you're spending 6, 7, 8, 9 hours a day at your desk, ergonomics means that we are setting up that desk to minimize any kind of strain and wear and tear as you sit at your workstation and do your job all day, every day. When we approach a cervicogenic headache patient, there's a couple legs of the stool that we have to address, and if we leave any of those out, we often don't see the results that we do. But usually it's adjusting to get the joints moving better, some muscle work and some rehab to address any kind of muscle imbalances that may be present, and then also teaching our patients how to set up their workstation so that they can minimize any kind of wear and tear on their spine going forward. So if you or anyone you know is struggling with headaches, we have had tremendous success with our headache patients of getting them out of pain, reducing their frequency of headaches, and doing so without any kind of drugs or surgery. So if you or anyone you know is struggling with headaches, reach out to us, send us a DM, call us at 316-685-4965, and we'd be happy to take a look and see if we can help you get over your headaches the way that we have done with so many of our patients in the past. I'm Dr. Mike Stanley with Stanley Chiropractic. Thanks for tuning in today, and I'll see you next time.